10,000 healthcare workers have voted to go on strike, saying they've had enough of being disrespected by their employers. They include contact tracers and lab workers who carry out COVID testing.
And they plan to carry out two 24-hour strikes on the 4th and 18th of March, when the Omicron outbreak could be at its peak. Here's our health correspondent, Lucy Warhurst.
Waiting in line, killing time. There's been no easing up on testing, with more than 32,000 yesterday. Reasons to get tested if you're sick.
Feeling a little bit tired and runny nose.
Or a
close contact. Just want to come get tested and see if we get the negative.
But soon it could take longer to get your results after 10,000 health workers, including lab workers that processed the tests, voted to go on strike.
If we go on strike, COVID testing will be delayed. But we need to be listened to from the government, and we need to be appreciated for all the work that we do.
But the Health Minister was blindsided.
I'm not familiar with exactly what you're talking about, so I'm reluctant to comment on that. You've ambushed me. I'm sorry, you've ambushed me, and I'm not familiar with that.
Modeller Dion O'Neill says today's case numbers don't tell the full story.
Today's new infections probably likely to be about sort of 4 times the 1,500 today, so that's on the order of maybe 5,000 or 6,000 new infections.
Infections that will soon turn into official cases. And nowhere's immune. Starship Children's Hospital in Auckland is working to limit the spread of an outbreak after 6 staff and 6 patients tested positive. Meanwhile, hospitalisations for COVID have gone up more than 5-fold in just 1 week, from 12 to 63. And we're far from the peak, with daily cases set to soar.
In the tens of thousands. It's really hard to tell what that peaking looks like. Part of that is because while we're describing this as one single outbreak, it's really a number of multiple outbreaks in different areas happening at different times.
The Omicron wave gearing up to be a bit of a roller coaster.
Well, kia ora, Lucy. If the first strike is scheduled for March the 4th, how bad will COVID numbers be then?
Well, in 2 weeks from now, we could be seeing 10,000 daily cases or more. By the 18th, that could be into the tens of thousands. Healthcare workers, though, say that they are already burnt out, and this strike action is a last resort. The Health Minister has now responded, telling Newshub that he thinks that these healthcare workers should be well rewarded for what they do. He's urging DHBs to do all that they can to find a resolution and to avoid strike action.
Health correspondent Lucy Warhurst, Tanakwe.